Before we collect blood using capillary tube to our client, we must do an assessment first. So, first is assess the frequency and type of testing. Next is the client's understanding to the procedure. We also need to assess the client's response to the previous testing. And lastly, the client's skin in the puncture site to determine if it is intact and the circulation is compromised. So after assessing, we will now need to determine some conditions such as assistive devices that will be required, the client's record for medication that may prolong bleeding such as anticoagulants, and lastly, the assistance required from other healthcare personnel. So in the planning, we will need to assemble the equipment and supplies that we're going to use, such as the alcohol, paper towel, sterile lancet, the antiseptic swab, or the cotton balls with or without alcohol, and the capillary tube, and a pair of disposable gloves. As for the implementation, I will explain to the client what are we going to do, why is it necessary, and how to connect and operate. So, good morning ma'am, I'm Michelle Cordero from NUST, and today I will be your student nurse. May I know your name and your birthday?
I'm Julian Morales, November 26, 2000.
So, I will be collecting a small amount of your blood on your fingertips. Is it okay for you?
Yes.
So, before I do that, I must perform a hand hygiene. After that, I will provide the client's privacy. And after that, I will now prepare the equipment that I will use. Take a green dry towel and get a capillary tube. Place it there and the lancet. I choose a vascular puncture site and use the antiseptic swab to wet it and let it dry. And while I'm letting the puncture site dry, I will now put on my gloves. Now I will prick the site with the lancet using a darting motion. Wipe away the first drop of blood. Put pressure, please. Disposal answer. So, for the evaluation and documentation, send the specimen to the laboratory immediately along with the laboratory form. And we also need to pull off our gloves and perform hand hygiene. Document the procedure in the designated place and mark it off with card text.